All right, I think we're on. Hey, everybody, this is Dr. Cheng Ruan, and I'm super duper excited to have my friend Jill here with me. And we're going to get really much into the physicality of the body, but more importantly, how to take an outside-in approach. An outside-in approach really means like, how do we honor the structures of our body to translate into things like chemistry and hormones and stuff like that that's internal. And so in this discussion, we're going to tackle the fascia a lot. So Jill, let's start with you a little bit. Tell us a little bit about your background, and we'll kind of dive into what the fascia is and why do we care. So let's start with you.
Yeah, well, I have been I was first a dancer for decades, retired from that and dove into, and I was always teaching dance at that time, dove into Pilates, and I've been a certified Pilates instructor for 20 years. So I've always kind of been studying the body and how to really move it efficiently and effectively. And I started, like many people, hearing and learning about fascia, and it was amazing to see just how much people have a disconnect from it and how much it affects their structure and how life emotionally and stress and trauma and all of it affects how we're carrying ourselves and how we're moving through the world. So I just kind of geeked out and kept diving in more of it, studied a lot of fascial release and fascia through movement. And yeah, and it's been a real game changer for me and the people I work with.
Yeah, and so what I want to talk about is like fibromyalgia and chronic pain, and this topic is one of those things that a lot of primary care doctors kind of roll their eyes on for three reasons. One, they don't really understand how to treat it as very effectively. Two, it's a lot of work because we're dealing with a population that goes through daily struggles that they may not understand with, right?
Yeah.
And three is that even if it is treated, a lot of it's pharmacotherapy, right? Medications, right?
Mm-hmm.
But as you and I know, it's a lot of pharmacotherapy may backfire on people, and people are really trying to seek out like what is the real answer that are right here, right?
Yeah.
So here's my story with this, and I don't have fibromyalgia, but at one point a long time ago, this is 11 years ago, actually 11 years ago, I started doing something interesting. I started reaching out to organizations trying to see if they have solutions for chronic illnesses. So the Fibromyalgia Association happens to be in Houston, where I am now. And so I reached out, and there was already this holistic approach into chronic pain and fibromyalgia. So here's the thing. So what I thought was interesting is that a lot of the stuff I didn't learn in medical school, didn't learn in residency, didn't learn in training whatsoever. But a lot of stuff I learned from my mom, who's an acupuncturist. And so as an acupuncturist, it's all about the fascia, right? And so my journey with it came that a lot of different diagnoses and disease states that I was really dealing with actually rooted in the physical structure of the body towards alignment, getting that balance, that yin and the yang in, right? And when the balance is off, it translates into things that are internal, like labs could look off, right? So, and so that's also not something I necessarily will learn in school, but now I super appreciate it. And ever since I met you, I appreciate it even more. So a lot of what I went through is concussions, sports injuries, neck pain, shoulders always up here, right?
Yeah.
Chronic pain, lower back issues, knee osteoarthritis and stuff like that. But then in the fibromyalgia population, what I see is daily struggles with temperature regulation, the hands and the feet, the migraines, right? The TMJ issues, right? Sleep dysfunction, right? We're seeing a lot of grinding. We're seeing a lot of like this position where the head's really tilted forward, the chin's back, and the shoulders really up. So like in my field, we call it like the fibromyalgia look.
Yeah.
But I learned about the fibromyalgia look, but I didn't know why it existed. And so this is where I kind of discover the fascia. So Jill, can you break down what the heck is a fascia? Well, what is that?
Yeah. The fascia is the connective tissue that goes around every muscle, every tendon, every ligament, every bone, every organ. It is our soft stocking structure holding us up and creating space between things. And it has 250 million nerve endings. It's our largest sensory organ. And I like to think, so fascia, when it's healthy, it has a crimp, right? So if you think of like a wine sleeve, it's really organized, right? And it facilitates blood flow and oxygen through the body. And what happens through basically the human experience? You have stress, you have anxiety, you have pain, you have trauma, emotional and physical, you have overuse and injury through repetition, you have not enough movement, you have poor breathing patterns. All of those things take that fascia system and do this to it. It gets crumpled up, right? So now you're not getting that nice blood oxygen flow. It's creating that pain and that lack of mobility. It builds those lesions, those knots on it. And the muscles underneath it can't fully contract and release anymore. And we lose that connection to our muscle and our body itself. I forget what I was going to say next, but yeah.
Okay, well, that prompts me to think about something. So you said the wine sleeve. The wine sleeve is, for those people who don't know or don't drink wine, is my wife drinks wine. I don't drink wine, but it's it's basically this netting that's on side of a wine sleeve, and it contours to the actual bottle. So I've never really thought about it like that. So the wine sleeve philosophy is that there is a structure, there is a thing wrapping it. So that could be a muscle, it could be a tendon, it could be a ligament, but that wine sleeve is always moving. It's a biologically active thing. It's not a dead thing. And so back in anatomy class in medical school, one of the most annoying things to cut through is actually the fascia, because even with a blade, it dulls my blade. So the fascia is a really tough structure, okay? So that tough structure has a bazillion different nerve endings. What, 250 million?
250 million, yeah.
I didn't know that. That's kind of cool. So the fascia can produce pain and it can produce inflammation. And even in lab work, you can actually see it on several labs like HSCRP and several different labs. So that netting that's there, although it's conforming to it, that conformation is trying to compensate usually for something else. And that's, I kind of learned that the hard way.
Yeah.
So, for example, if someone is sleeping on a not too high or too low of a pillow, your body's fascia is trying to compensate your positioning for it, right? Same thing with too soft of a bed or too hard of a bed. But more importantly, people who've gone through traumatic experiences, either it's emotional trauma or physical trauma, can actually have chronic fascial tightening from concussive injuries like myself, and even emotional traumas as well.
Yeah.
And that all gets pent up. So, and there's evidence of fascia everywhere. So, Jill, you and I were in an airport. We were in Costa Rica together for a conference, and one of the things that you pointed out is you're just looking at people walking. You're like, I'm like, what are you looking at? Like, what is it about the way that they walk, to hold themselves? And I'm like, well, what do you see in me? So I kind of like for you to let us know, like, what do you see when you actually see people in pain or walking through an airport? Like, what are you identifying and picking up there?
Well, yeah, it's a structural misalignment. I'll start with this. Are you familiar? You know the Hoberman sphere, right? The little sphere that it's kids have it, those toys you pull. And when that's your inhale, right? It should be. We expand in all directions, and that creates tensegrity and tension in our body, which helps build the collagen and strength in our fascia as well, right? And it's so amazing because the first thing I look at people is, where are they breathing, right? And generally, it's up here, right?
Don't judge. That's me. Yeah. Okay.
Yeah, you and 99% of other people. And,
Yeah.
so the first thing I generally see is that their breathing is up here. And why is that? Maybe from too much sitting, maybe from pain, right? Because when we're in pain, we pull in. When we have trauma and stress, we pull in. We want to hug ourselves. Everything tightens up, and then our fascia does with it. But then our diaphragm is stuck. And you could try to meditate until the cows come home, but the diaphragm, if it's stuck here, the fascia around it, it's impossible. And the breath gets redirected here. So I always am like, I just want to first release everyone's diaphragm so that they can take a full expansive breath. But generally, like you said, what I see with so many people, and now especially with the phones, as we are at the airport, right? That 90-degree, Everyone hold your phones up here. But that whole sunken, the chest is collapsed, which pulls on the neck. It pulls the head forward. And then everyone has that, tension up in their upper traps. And that's also where they're breathing. There's more tension here. Everything in that back line, that diamond fascia net that kind of goes head, shoulder, trap, like that is that's not strong. It needs to pull back all of that tension through that backside.
Well, that's what you're seeing with people
Yeah,
walking through the streets
I
doing
do. And their arms are rolled in, their palms are facing back. Yeah. And I just want
the
to rotate.
gorilla look.
Yeah. And then and that's that hunch on the back, then that turtle shell, and it becomes more of a weight and everything. It's like everyone's losing the fight against gravity. Right.
Okay. Yeah. And that manifests as physical symptoms, but more importantly, it manifests as things that we see in medicine. So talking about fibromyalgia, chronic pain that compresses the airway, people can develop sleep apnea. That also causes a lot of different spasms in the hands and the feet.
Yes.
But there's this one thing that I recently learned about in the last couple of years that kind of blew my mind a little bit. And I stumbled upon it by accident. So there's these clinics, these chiropractic clinics that treat peripheral neuropathy. Peripheral neuropathy, for those who don't know, is basically abnormal sensation of the peripheral nerves, hands, feet, anywhere in the body. Can create tingling sensations, temperature dysregulations, and usually the neurologists are actually testing using different tools to test for nerve conductions, and they're able to see that there's misfiring, or actually just we call it amplitude abnormalities. Basically, it means that the nerve is not conducting as it should of these nerve called C fibers, and we call it C fiber neuropathy. So there's in Chinese medicine, and I talked to my mom about this. The way you treat it is to direct localized fascial release into these areas. And post-treatment, you can see that the same test that they do for C fiber neuropathy, they actually release. So this is a concept called compressive neuropathy, where the fascia around this bundle of muscle and nerves are actually at the cellular level creating disruptions in flow of not just blood flow, but creating the disruptions of a flow of energy into these C fibers. So the autonomic function of the body becomes like very much disarray. And so whenever we started treating neuropathy like a fascia issues, people were actually getting better, right? Mm-hmm. And so is that some of the things that you see as well?
Oh, absolutely. And it's kind of like, a sponge. Because one of the components of fascia health is hydration, and that kind of slow press, so that when you release, more fluid can get in.
Right.
If you push on your hand, you see that, right? So it's amazing to do that with a client. If you kind of roll through some of that fascia, they can't move something, they can't engage their lower trap, they can't move their shoulder fully. And, sometimes just rolling through the lower trap and opening up the pec all of a sudden, and it doesn't take much time, and a couple little slow rolls where they're really letting go, melting and releasing. All of a sudden, it's like their arm just flies away. It's amazing.
So when you say rolling, like, let's talk about this, because there's you have these Manna orbs that you develop, right? And they're rolling with the orbs.
Yeah.
Yeah. Let's talk about that. Like, what exactly is that, and why aren't people doing it?
That's a great question. Again, I think it kind of goes into that whole idea. We're still learning so much more about the fascia still, right?
Right.
But that hydration, and that we talked about that disorganization in the fascia, and it gets all bounded up, and you get those lesions, those knots. If you take these balls and put them on one of those points,
okay,
and really you can contract the muscle a little, and then as you exhale, release and let it go. So there's a lot of modalities you can use that kind of contract and release, a pin and mobilize, or that slow. You can use the ball to kind of do a slow plow along that fascia. And that's that whole idea of kind of adding that fluid back in and that smoothness back in, so that the muscle, the bone, the ligaments underneath it can move again.
Yeah. So now I'm playing dumb, but honestly, I've been practicing this since I met you.
Yeah.
And so I just want to experience it from like my side and what that really feels like. Now, I've used different like lacrosse balls and tennis balls to do some fascial releases, but this is so different because I feel like the actual density and the buoyancy of the balls allows more of an effective fascia release. And
Mhm.
so just to let everybody know, I have a lot of pectoral entrapment because my shoulder is always forward, like, Jill's judging me in the airport, phone, looking down on my phone.
With love.
Thank you. And so as I'm sort of rolling these balls, and one of the things that you want to do is kind of melt into it. And as you melt into it, all of a sudden you have sort of this sense that you're bringing in more air, right?
Yeah.
It's like
Yeah.
your breath is deeper, and all of a sudden, like a few minutes later, I'm normally 6'3". I feel like I'm 6'4" all of a sudden. Like, whoa, like I'm like I'm much more upright, right? My spine is better, and I just feel like running 10 miles. Like it's insane what a small amount will actually do for you.
Yeah.
So now I've tried to do this with like tennis balls and other balls before, hadn't really worked out, but I feel like that there's sort of this sweet spot that our body kind of responds to with this fascia, right?
Yeah.
And this sweet spot may be having to do with the density of some of these balls, but also like, and I think everyone's is different but similar. Different in that everyone has different body size, body habitus, but the fascial structures are identical in all humans, right?
Yeah.
And so so in my experiences, I'm kind of melting into this, I'm experiencing this open up. Now, and then I would start getting emotional. I'm like, whoa, like what is going on here?
Yeah.
I went from hysterical laughter. You saw me do this. I went from
Yeah.
hysterical laughter to tears in like 30 seconds. And then
Mhm.
all of a sudden I was done. I'm like, okay, like what just happened? Right.
Yeah.
So tell me about like what are some emotional aspects people can actually feel through this process?
I mean, that is it's so amazing, and it truly runs the gamut, and we kind of went back. And again, lacrosse balls tend to be too hard. The tennis balls aren't really designed to absorb our body weight. So the density of these balls have a little give before they come to support, but it's also that grippy material of the orbs that helps grab the skin. And we use that in some techniques to hydrate the superficial tissue. Okay. So many of us, like, what do we do when we're scared? What do we do when we're happy? And what do we do if our shoulder hurts? It's our body instantly responds to that,
Mm,
and it locks into it. And so, people that have had a lot of heartache, for instance, it's that whole kind of like sunken chest. You can kind of see it. And
right.
I've had the same experience with them where the goal is to go really slow
Mm,
and to connect with it and use your breath. And people just kind of want to rush through it, check it off their list and go. But when people can be present and get their mind and tissue kind of connected, and that idea of melting and letting go and telling the tissue it's okay, you don't need to be on fight or flight or protection mode anymore.
mm,
People get really emotional because they discover how they have been in that fight or flight or protective mode, and their body, even if they've mentally processed it, their tissues have not. And so it is super powerful. People will smell things and cry and laugh, but then that joy they have when they let it go, that's the same. It's like I have clients that'll literally start skipping around and look like they're a child again because they're very playful in their movement, which is
yeah.
pretty cool.
I think I literally skipped around the table that time.
Yeah.
But I'm gonna bring some value into what you just talked about. So I'm gonna bring into the pathophysiology or the physiology of exactly how that happens. How does the fascia tie into emotions? All right, so get ready for this. This is super cool.
All right.
So our body has this beautiful system called the autonomic nervous system. And the autonomic nervous system has a yin yang balance, right? There's the sympathetic, the fight or flight, and the parasympathetic, the rest and digest. But the parasympathetic is not just rest and digest, it's also blast. It's freeze. It's like it's the state where nothing can go, right?
Mhm.
So in neurology, especially looking at EEGs, you call this like the no-go state. NOGO, no go, like no go. You're in the parasympathetic state. And then on the brain mapping, we can actually see that there's a go state, which is like a boom, you're going, like your cortisol, your stress hormones going, right? That's the sympathetic state. So as it turns out, the nerves that are actually in the fascia is controlled by the balance between this go and no go state, right? And so if you're always on the go, 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 your fascia is tense. If you're always like no go, no go, no go, not doing very much, your fascia is also tense. And it's because that are involuntary things that happen to our body when we are in this phase. Really good example. Let's say that someone sneaks up on you, you're on your phone, and you gasp, right? Blood flows away from your face. You go a little pale. Well, what's causing the blood to go from your face? You look pale. It's the fascia contracting right here. The look, right? That's from a sympathetic fight or flight response. So if instead of a friend scaring you, what if it's perpetual trauma or post-traumatic stress you've kind of experienced in your head, the subconscious state or the conscious state for a long period of time? You're persistently not hydrating like the face, the fascia, and all that starts going away, and you create sort of this Frankenstein stiffness that's right here.
Yeah.
And our body learns to exist like that. And when our body learns to exist like that, our brain frequency patterns can't get out of the go phase, and it's stuck there.
Yeah.
So on brain mapping, which is what I do in my clinic, you can see the EEG just go like this, right? We call the high beta or gamma frequencies go right, and then all of a sudden it'll stop and go into like a really low frequency. So people can get stuck between go and no go, which means they're either on or they're off. They're going, or they're really, really tired. And these are the people with the most crazy, like contracted fascias that we see, right? And so now it's that same autonomic system. Well, that's the one that tells you how much your bowels work. It controls your microbiome, controls your gut bacteria. So you can take probiotics all day long, but then if your fascia is so contracted like this, it's probably not going to do anything, right? And the other thing is that it controls your hormones, control the endocrine system, your thyroid, your progesterone, your pregnenolone, your estrogen, estradiol. All these different systems are actually a manifestation of what happens when there's fascial constriction and decreased fascial relaxation, and also it's actually squeezing things out of the body, right? And so the emotion comes from different neurotransmitters in our brain that once the fascia like lets go, it feeds back to the brain that you're safe. And the hysterical laughter, the crying, all the emotion that comes out is that the body now is receiving for the first time in a long time that I am safe signal. And that's where really the emotion comes out. And that's what the neurotransmitter is like, okay, what's going on? Am I happy? Am I sad? Am I both? Right.
Yeah.
And sometimes there's a bit of a conflict. And then after that, after the purge, it just calms down. Now we're good. Now we're focused. Right. And that's a beautiful thing to experience, a beautiful thing to watch for people.
Absolutely. Absolutely. It's been really amazing seeing some of your patients who have gone through so much and live in a great deal of pain. And, I hear their stories and my heart goes out to them. Being able to move the needle just a bit on their quality of life and how they're feeling in their body is such a gift. And it's amazing to just see this kind of wave of relief come over their face and their body. And it's such a simple thing that people can all do on their own. And then that's one of the best things about it, I think,
Yeah, absolutely. Yeah. And honestly, a lot of times, all people are trying to do is to feel a little bit better, right? Like even 5% better is a huge improvement in life. But oftentimes we're seeing that 5% better, if it's controlled by the person, if I have the ability to make my day 5% better, that's worth a lot more than someone else making my day 5% better, right? And so for those people who don't know what Manna orbs are, they're these right here, right?
Yeah.
And so can you walk me through some of what we just talked about? So first we talked about like releasing some of the fascia in the chest and neck muscles, right? Can you kind of walk me through? I'll be the person that's demoing. And if you have balls yourself, you can do it. I'll mirror it with you. What are we talking about here for these orbs?
Okay. With the small one?
Yes.
Okay. Well, you talked a little bit too about that forward neck thing and the TMJ and how many people clench through the night.
Me.
So, okay. one of my favorite things, and I like to do this lying down with a yoga block, but even if you kind of stand up and put that orb right at the hairline, right at the bottom of the cheekbone.
Okay, bottom of the cheekbone, right? Okay.
Okay. And put your palm on top of it.
Okay.
And just with this, again, think of that sphere. You should always be able to breathe. If you're holding, going too deep, but you can slow pressing into it, start to roll it forward.
Okay.
Now, when you get to a tender spot, maybe I
here.
want you
I'm
to
here.
open
Oh,
your
yeah.
jaw for me, nice and slow.
Wow.
And see, do that a couple times. Big inhale. And then exhale. Let it relax. Good. Maybe do one more big opening there. Exhale. And you can explore all the way forward, right?
Just move the ball for a little bit. Yeah.
All the way along that cheekbone, as far forward to the end of the cheekbone. And
Yeah.
you can always, again, when you hit those little tender spots where it's tight,
Yeah.
just open and close your jaw. You can even just chug the ball a little bit.
Yeah.
And then what happens when you take that out, even just from that short moment, and you open your jaw?
Ooh, little dizzy here. Yeah.
It feels a lot different on that side, right?
Yeah, the blood flow's actually coming back. I just want to take a nap now. But in acupuncture, there's different points here that release the fascia locally to allow for the drainage of the sinuses, right?
Yeah.
And
Yeah.
so I was actually doing this when I get in bed, and all of a sudden I'm like, my nasal passage cleared up. I'm like, whoa, what's happening there? So
Yeah.
it was actually quite good. And what about this big ball? What do I do with this?
All sorts of fun things, but we talked again about the chest and the forward position. So yeah, so I start with it kind of center in towards the sternum a bit. And again, I usually do this against the wall, but what we do is kind of pressing is you can slowly roll it towards your shoulder. And when you hit that tender spot, you hold and you inhale, kind of breathe into it. And exhale. Right. And you slow kind of work your way all the way out. And generally, that would take like a minute to get there, right? But another cool thing you can do if you're not doing it against the wall is you kind of go center. And it's best to have it on your skin, but you kind of dig and twist the skin a little bit. And I'm pushing it down on the diagonal, and you turn your head away from it, and you feel that whole fascial line stretch out.
Yeah, this is a very powerful move. And in fact, this is surprisingly, this one has really helped me when I'm bloated. So
Yeah.
if I have like indigestion, acid reflux, this fascia release actually resolves a lot of stuff, which is very interesting as well.
Well, and one cool thing I always have clients do is after they roll that side to like close their eyes and take a deep breath. And they all say, all of a sudden they can feel air fill up on that side.
Yeah,
Super,
absolutely.
super subtle, super powerful.
So there's people who sometimes when we order CAT scans and radiographs and X-rays, we can see lungs compress. We call it atelectasis. And as that compresses more and more, we actually know that there's not enough air going through. So sometimes respiratory therapists will pound on people's back to kind of open those up. What they're really doing is indirect fascial release, right? And so even in the hospital, like as intern, when I was an intern, my job was like pound on people's back to open up those respiratory units to kind of stretch them up a little bit. And sometimes on the next day, the X-ray will be much better. It actually prevents pneumonia, right? In hospitals. And so a lot of people who do have sort of this forward neck posture, the diaphragm never really lowers, the breath never really comes in. Now, we're all upright organisms, which means we walk upright. So all the blood flow is actually towards the bottom part of the lungs. And if we don't fully engage the diaphragm all the way down, there's no air going to the bottom part of the lungs. So there's less oxygen, carbon dioxide exchange. So people naturally breathe shallower, like I'm doing right now, because I haven't stopped talking this whole time. So as you breathe more and more shallow, you get that chronic fatigue and that sensation, and people call it different things. You can call it adrenal fatigue, you can call it adrenal burnout. But in the grand scheme of things, it has to do with allowing yourself to get into that breathing and the breath mode, right? And
Mhm.
so, and that's really important even in brain health, because I see a lot of people with Alzheimer's disease and Parkinson's and stuff like that. If their postures in a way where it's like kind of shriveled up like this, which a lot of them are actually, right?
Yeah.
Working on that, I was really surprised to see how much we can actually move the needle on their actual brain health, cognition, speech,
Well, and
etc.
also because they're able to sleep better too, right?
Yeah.
They're able to sleep better. Their brain does what it needs to do when you're sleeping, and it's all connected.
Yeah, absolutely. And then there's a lot of people with like migraines and chronic pain, especially in the jaws and the cheeks, trigeminal neuralgia, stuff like that, right? What's your experience with people with like migraines, for example?
Oh boy. Yeah, it's interesting. And that a lot of people suffer from migraines. And it's interesting whenever people tell me they have headaches or migraines, I'm like, okay, the first thing we're going to do is roll your feet. And they're like, no,
Your feet?
headaches? Like, yep, with their feet. Because you have that fascia line that starts from the bottom of the feet, goes up the whole posterior side and connects up here, right? And generally when that's tight, oh, all that compression through there.
All right, let's go back for a second. So someone says you got a headache. I'm like, let's start with your feet, right? It's really counterintuitive, right?
Yep. Yep. But they, again, it's amazing how quickly they're like, oh, wow. And I've had clients that have said they were, I couldn't sleep. I had a headache, got up, rolled their feet and fell right asleep.
Yeah.
But there's all sorts of things, generally, if our skull isn't placed exactly where it needs to be on top of our spine, I always tell people, imagine you have a 10-pound dumbbell on your head. That feels fine there, but you just tilt it forward just a little bit all day, like the strain it causes and all of that, right? So I also like to get right under the skull, and we do a lot of rolling through there, which the minute people lie on the orbs with their skull on that, it's like a slice of heaven for them. It's a really tender spot for many people. So we do a lot through there, through the mastoid process too, like anything that connects through the up into the skull tends to be really powerful too.
Yeah, yeah. And so for people with a lot of chronic pain, fibromyalgia, there's always a lot of tension that's there, a lot of tenderness that's there. But the feet thing was counterintuitive to me.
Mhm.
But I remember when you told me that a few months ago. So I actually did try it, and I actually tell some patients to try it as well, kind of rolling the feet. It doesn't just make a difference in the actual like migraine or pain or something like that. Like the rest of their day is actually a lot better. They're
Mhm.
able to do things. All of a sudden, they want to go shopping. Whereas before, like when they start in the morning, you're like, oh, I don't want to do anything, right?
Yeah,
And it's
yeah.
so interesting. All they did was kind of roll their feet. So I'm a believer now. I was a huge skeptic before. I'm a believer now for sure. But this goes to show you how amazing our body is. So even in the field of acupuncture, you have meridian points like in your feet that you can do acupuncture needles and stuff like that. And so, although it seems like fringe science, and here's the reality behind it. And so, there's this highway system in our body that controlled by the fascia, that is a microscopic system called the glycocalyx. And the glycocalyx is actually several superhighways in our body that's faster than nerve conduction, that's faster than hormones.
Mhm.
And the glycocalyx has specific channels that go from our guts to different areas. The glycocalyx has been recently researched a lot in cardiology. It's what causes heart disease and clots with the glycocalyx and the protein forms together. So with acupuncture, we know that there's glycocalyx manipulation. With fascial release, there's also the glycocalyx, which is sort of this wine net membrane that's right here, right? It also starts loosening up and it transports different proteins. And the biggest glycocalyx network in our body is the gut microbiome. So a lot of times people say, hey, you know what? Most of the disease and disorders start in the gut. Well, I would say it probably starts in the glycocalyx and the fascia, and then our gut
Mhm.
translates it into different things, right? And so I think this is the real science behind it. And the guy who discovered this won the Nobel Prize 10 years ago, the whole glycocalyx concept. And so we're just stepping into how science is able to explain all these things that we see from a holistic standpoint. And right now this is sort of the beauty of where science is going, right? And that's why we're able to have a conversation like this, kind of marrying together the latest science and things that have been known for a long time, right? So I want to kind of go back to earlier. You talked about hydration. So in my world, hydration means drinking water, but you're talking about hydrating the fascia, right? Like,
Yes.
what does that mean?
It means making it more pliable.
Okay.
Fascia should be, I mean, fascia is strong,
Yeah.
right? But it should move and it should stretch. And when we have injury and those proteins all build up that again kind of protect us in that healing phase, they're meant to break away. But if you're not doing things to make that happen, they get hardened. And then we again like kind of restricting our mobility and creating more pain. So, that the rolling is one of the best things for hydration. Bouncing is really good for hydration as well into that fascia. And then we can actually, again, accept more hydration into our body. You can drink all the water in the world if your fascia's not accepting it.
Yeah, that makes sense because in the field of medicine, we have this thing called third spacing, where people actually accumulate fluid not within the vessels but within the muscles and interstitium, right? And they're actually locking away fluid. So if anybody's experienced like leg swelling or after a long flight or having too much salt or carbs and stuff like that, that's called third spacing. And so, well, it's really well hydrating your tissues, but it's staying there, but it's not hydrating your fascia or any of your organ systems, right? And so you're basically mobilizing this pool of water there, like back into the delta, back into the river, back to the stream through the fascia balls, right? So part of hydration is so this manipulation of this, the where the stream is like overflooded. Hey, let's get it back into circulation, right?
Well, I think about like, when you sit for 20 minutes or when
Yeah.
you're sleeping, you get this layer, like almost like this fuzz over your fascia, right? And what do animals do when they get up from lying down or from a nap? They stretch, they move, and that resets the fascia. What do most humans do? Make a coffee, make me look at their phone.
Go to Starbucks. Yeah.
And then they might pick up something heavy and then they've strained that whole system, right? So I tell people a simple thing everyone should start doing when you wake up. Exaggerate yawn stretches. When you get up from sitting at your desk, exaggerate yawn stretches, move your body, and it resets the fascia, which is so
So
simple and
so
such a difference.
do what cats and dogs do,
Exactly.
downward dog, yeah, it's
Yeah,
yeah.
just move. It doesn't have to be fancy. You don't worry about what you look like on the outside. Just move.
Yeah, no, that's amazing. And a little bit goes a long way as well. And in the field of chronic pain. So just before I was talking to you, I was talking to a pain management doctor and also a massage therapist, separate conversations, right? And the conversation kind of naturally falls into the myofascial response of people.
Yeah.
So the pain management doctor was talking about how there's so much interplay between our like internal chemical structures, our gut microbiome, our hormones, and the actual like fascia that's there, that to just focus on one element, ignore the other is not reasonable, like in modern day, right? We
Yeah.
have really, really fancy tools and labs and gut microbiome studies and all the stuff that we do in functional medicine. We have really fancy tools to look at every little element, toxicities and heavy metals and stuff like that, right? But we don't necessarily have a tool to look at fascia other than our eyes and other people, right? But I think over the last 100 years, we've been taught to not trust our eyes, especially when technology is coming into play. But at the same time, we probably should, right? Like you looking
Yeah.
at people in the airport with their head down, you're like, oh, if you just straighten up a little bit.
Just one little thing will affect how you feel. I'm sure you get tension headaches. I'm sure you can't breathe.
Yeah, yeah. And it's funny because you can actually look at someone and have a prediction of what their symptoms might be now. Now you've been doing this for a while, right?
Oh yeah. Yep.
That's just the power, the
Well,
magician
and
in
it's,
the room.
and everyone's story is unique, and it's interesting when people tell me their symptoms. I'm like, "Mhm. I know exactly what's going on. I can help you." And it's pretty powerful.
That's
You know,
awesome.
It's all complex, but it's also makes a lot of sense and simple in some ways too.
Awesome. Well, Jill, listen, like, you made a big difference in my life personally with my own issues, and a big difference in a lot of our patients' lives as well. How can people find you? How can they find more about you? Where can they get these really cool Manna orbs?
You can check me out at Manna Pilates and Health. That is our website. You can also go to mannaorbs.com. That'll get you rolling with our tools and some free guided tutorials. And I also have a online course to guide people through rolling out the entire body.
Awesome. So Manna is two N's, Manna, orbs, ORBS, right?
Correct.
And if people are watching this, there's actually a QR code I'm gonna put into here. You can, I don't know if you can see that.
That's right. So you
Scan
can
that
order,
QR code, right? Yeah.
you can order those on Amazon. You get that QR code, you scan it, and it'll take you through some tutorials.
I love Amazon Prime. That's the best. And you know, one thing that I do want to kind of close off here is to have sort of an appreciation, right? I think that when I went through medical school and medicine and stuff like that, like my mom's an acupuncturist, Eastern medicine doctor. Now we're going back into her fundamentals, right? Even after all the stuff I kind of learned through medicine, pharmacology, and all these sort of fancy things that we have, we're kind of going back into basics. And it was a natural progression, you know, for me. And so, what is, I guess, one message you want to provide to the world of people who are actually living in chronic pain?
Oh, first of all, I'm sorry that you've been living in pain. I know how exhausting and draining that can be. So much of your energy gets pulled into that. But there are some simple things you can do, like Cheng and I talked about, to just even move the needle a little bit. That will feel amazing. And going back, you know, I was talking to a client recently, we're like, gosh, remember, like, people are like, you have to go to the gym and do this, and you have to do that, and you can only eat this. And now it's like sunlight, sleep, breath. And I think starting with the breathing, getting the diaphragm to release, really focusing on that is like number one. Being able to breathe is so important. And to just move your body fluidly, simply. But three, if you are living in pain, try out some of these techniques we've been talking about, because you will really be amazed at how instant you can feel some relief.
Awesome. Yeah, once again, that's mannaorbs.com, right? MANNN. Oh, sorry, MANNAORBS.com. So we'll check out some of the free videos that are on there. So awesome. Well, listen, thanks for being on. Our time is up today, but not forever. I'm sure we'll have you on a whole lot more as well, as we kind of dive into more of the intricacies of the body, the fascia with chronic pain and chronic fatigue. So thank you very much for being on.
Much more. Thank you for having me. Enjoyed the talk.